Good afternoon. This is Dr. Famuyiwa. Today on Fertile Talks, we're going to be breaking the silence. I've been trying to break the silence, but we're going to break the silence on male fertility, male factor infertility. Now, we do know that male factor accounts for 50% of why people cannot get pregnant, but we don't often talk about it, and there's a silence around this. There's also a knowledge gap about what male factor infertility is. So, we're going to tackle the causes of male factor infertility today. We're going to tackle the diagnosis as well and what can be done about it. And we're going to also talk about the emotional impact of male factor fertility. So I hope you guys are listening. And if you know someone who needs to hear this, please share this episode. So let's get started. So we know that, as I said, male factor infertility accounts for 50% of all infertility cases, right? And how do we evaluate it? Central to diagnosing male factor infertility is what we call the semen analysis, which is our primary method for assessing what's going on. What this does really is look at three main things. There are other things we look at, but there are three main things. One is the sperm count. Are there enough sperm? Motility. Are they moving or swimming properly? Morphology is, are they shaped correctly? Because incorrectly shaped sperm may have a difficult time fertilizing an egg, right? So the shape is very important. Um, So a semen analysis is obtained, and we start to cluing on what's going on if we have abnormal findings. When we see abnormal findings, we want to look at what are the potential causes. Well, the potential causes are very wide. Um, there could be genetic disorders such as Klinefelter syndrome. Some patients who have severe depletion of their numbers may actually have parts of their white chromosome missing. So, if the numbers are very low, we want to look at their genetic makeup. Are they missing portions of their Y chromosome? Other things that could affect male factor include medical illnesses such as diabetes, autoimmune diseases, even cystic fibrosis. Believe it or not, can affect male factor. Things that most people may not think about would be infectious diseases, and I'm talking sexually transmitted infections. Those could affect the semen analysis result. Other things that are not necessarily infectious would be what is called a varicocele. A varicocele is an enlarged veins that delivers excess temperature, blood flow to the testes, and it heats up the testes and causes problems. It impairs sperm production. Previous treatment, patients who've had cancer treatments in the past. I remember I had a gentleman who came in to see me with his wife. He was in his 30s, and we did a semen analysis, and there was no sperm whatsoever. And he told me, yes, he had testicular cancer when he was 16, and his parents had been so scared, and everybody was so scared. And of course, I understand that when you hear the word cancer, everything else goes out the window. So they just focused on getting him well, chemotherapy, radiation, blah, blah, blah. But no one focused on potentially freezing sperm at that age or even testicular tissue. So he had none, unfortunately, and had to um, use a sperm donor. Um, some people may have had testicular trauma from accidents, and that could also impair production. Incidentally, one of the causes that I've seen in some of the gentlemen, especially who come from certain parts of um, the world, may have had childhood mumps infection, and they were treated and no one thought about it. They had, mumps when they were 10 or 11 years old, and all of a sudden we're having issues with the sperm, and it can be very, very devastating to find out at the time they're trying to start their family. Other things can be related to their lifestyle, such as smoking, vaping, marijuana use, excess alcohol consumption um, can impair sperm production. High heat exposure. Think hot tubs, laptops, prolonged laptop being on your lap, jacuzzis, saunas, obesity by increasing body heat can also cause impaired sperm production. And poor sleep. Poor sleep works through disrupting the hypothalamic gonadal axis and disrupt the hormonal signals going to the testes. Exposure to environmental toxins can also affect sperm production. Another thing that most people don't realize is age. Age, yeah, it's not just the eggs that get older. Sperm is also affected by age. So some of our gentlemen may want to consider freezing their sperm. I can't, let me say that again. Please, if you're not prepared to have children at this time, but you think it's a possibility, just freeze your sperm wherever you are, however old you are, right? Freeze your sperm. So let's talk about what are the current advances that we're seeing in the field for infertility treatment that applies to male factor. A lot of things are rapidly changing. Now we have artificial intelligence that is able to detect very subtle sperm defects with far greater accuracy than the traditional human analysis. And this is very exciting. I think if you've been listening, you probably heard in New York where they used AI and they the first child using AI on male factor was conceived. So that's very fascinating. I think that we're going to see more and more of that. Time lapse imaging is now being used to select the best sperm, and that's also another exciting avenue. So, once we make the diagnosis, there's also advanced reproductive technology that can be done, such as trying to locate the best sperm and inserting it one at a time into the egg. That's called intracytoplasmic sperm injection, or ICSI. There are other things that are coming up that we can use, such as antioxidants like CoQ10, L-carnitine, zinc, selenium. Those are supplements that may help to improve sperm quality. I know in our clinic, when you come in and you have an abnormal parameter, we do give a flyer where we list things you can put in your diet as well as supplements that we hand out to our patients. You can DM us and we'll be happy to share that flyer with you. In addition, some men may have what is called hypogonadism, meaning the signal from the pituitary is not going to the testes at all. All right, so they can't respond to by producing sperm. Those men may be given either HCG or follicle stimulating hormone. Believe it or not, FSH can help to stimulate the testes to start producing sperm. Surgical interventions. We now know that applying microsurgical techniques, especially for patients who have varicocele, dilated veins, you can use microsurgical techniques, and that leads to better recovery and higher pregnancy rates. Um, Now, vasectomy reversals are having higher success with, again, with microsurgical precision. And then, of course, there's microtestes where they're extracting sperm from the testicles, but using again, a very powerful microscope, so you're going to the right spot. And of course, there's robotic assisted surgeries emerging as a tool that can be used. Now, beyond the medical side, let's focus a little bit about the psychological impact of male factor infertility. I think that's often overlooked. There's a severe emotional toll with this, and it sometimes leads to feelings of depression, of loss, of inadequacy, of failure, and these men suffer in silence. All right, so they struggle with feelings of inadequacy, of shame, fear, that they don't even sometimes share with their partners. And this is often exacerbated by our cultural script that men have to be macho, they have to be able to perform, and it takes a mental hit on this man. There's very little room for them to say that, I don't know how to fix this, or I'm grieving the loss of our fertility as well. And this silence breeds isolation. I remember I was in a conference and I spoke to a gentleman, a leading expert on um, male wellness, and I talked to him about the difficulty I have with some of my male gentlemen patients from certain countries who it's very difficult trying to reach them and trying to say, please take care of yourself, and this can lead to better improvement. And I'll never forget what he said. He said, why don't you flip the narrative and say, well, if you won't take care of yourself for you, will you take care of yourself for your partner, for your partner, whoever your partner is? And sometimes some of this men, they won't do stuff for themselves, but because they love their partner very dearly, they'll do it for them. So then, in that case, I'll plead with them. Please, let's do it for your partner, um, and see what we can do to help you get better. So, and incidentally, I cover all of this again in our brochure in the office, and it's also going to be more in depth in the book that I'm going to be releasing in March, called The Quest for Fertility. You can DM us and we'll put you on the VIP order list so that you get first dibs when it comes out. Um, so we can go into more detail here. So, proactive steps, let's look beyond the numbers. Let's try to adopt a fertility friendly lifestyle. Let's explore medical interventions from medications to surgery. And let's consider counseling. Like, mental health is very important here. And more importantly, the fertility journey is a joint journey. It shouldn't be isolated. It's not a solo journey. So again, if you found this to be very helpful, please comment, share this with someone that needs to hear it. Send us a like. And this is Dr. Famuyiwa again. Thank you for your time.